Good morning. Good morning. I am truly honored to be here and to be among a group of such distinguished individuals as well as class participants in this year's program who are really driving change for the future. It is an honor and a privilege to be here before you, and I would love to tell you that the journey that I as a nurse have placed is one of a nurse, it's one as a CIO, and it's also one as a patient. And I'd like to share my remarks with you that really are relative to each one of those three domains. The title, Network Integration of Information Technologies, is representative of that the technology is only a portion of the solution that we need in the context of care across our continuum. At a recent Scottsdale Institute meeting, we discussed healthcare and the changes that are going on in a way that represents that since the inception of healthcare, it has been a data-driven process. We just have not had technology tools to manage that process as equitably as we are able to do now, but it's always been data-driven. What we know and what we experience is how we manage our patient populations. We're now at the threshold of a brand new era in healthcare where analytics it will radically transform the way that we think about and plan for the care of our patients. The convergence of financial, socioeconomic, competitive, regulatory, and other technology trends are requiring that healthcare organizations think about ways to reformulate, re-engineer the ways in which they manage data and manage their patient populations across the continuum. I'm dealing with a few pieces of technology sitting up here. Okay. The objectives of this session, and I am also supposed to be controlling that, so hang on a second. Okay. The objectives of this session are threefold. The clinician and in technology and in data-driven roles is beginning to change the landscape of how we participate in our experiences within the healthcare environment. So we'll be exploring the relevance of clinician leadership and informatics technology. And number two, interoperability. We'll be discussing the interoperability that is essential to the context of care coordination and data availability for our clinicians. And three, analytics. Well, I'll discuss the related barriers and standards diversity that impact the network integration and the efficiencies that we seek to gain. We'll be looking at where and how data are arrived and what we are doing with them. On our way forward. It's not the strongest of species that survive, nor the most intelligent, but the ones who are most responsive to change, according to Charles Darwin. So we have come so far, and yet we are still at that beginning. According to the advisory board, the advisory board research on performance, as a clinician, improving patient experience requires new perspectives. Putting patients at the center of everything creates the environment for evidence-based practice, where clinicians feel that they can do the right thing at the right time for the right clinical reasons and have improved quality and outcomes. Value-based purchasing has created new financial incentives for performance excellence, driving significant executive attention toward patient satisfaction. Again, the patient is at the center of that composition. The key to the future is really not predicting, it's navigating. The landscape in which we navigate now is looking at velocity and volume. We're looking for the big rocks. We're looking for those components that really are most important as we begin to re-engineer the way that we practice. We're looking at aging baby boomers as well as millennials. We have to listen to what they want and respond to what they need. We're looking at outpatient growth, which is a direct departure from the environment of clinical nursing and care that is represented in the acute care settings of today. We're looking at making investments in unique strengths in our people, in our clients and in our partners. The tools and the strengths that need to evolve are ones that we need to invest in and need to be able to sponsor. We're looking at diversified services for ambulatory markets. It isn't just the traditional services that we provide within the inpatient environment that are important. It's also looking at the way that our consumers spend and the needs that they have with time-bound efficiencies as well as transparency. We're looking at the digital revolution with the idea that we must embrace it going forward, and in order to be able to amplify the clinical integration across that continuum. And we're also looking at and being very mindful addressing the threats to data integrity and privacy. It's one of those things that keeps a CIO up at night. Okay. So, according to the author Simon Sinek, author of Start with Why, How Great Leaders Inspire Everyone to Take Action, he emphasizes that the best organizations define why with a clear sense of destination and a vision for the future that doesn't exist today and must be built around individual emotional commitment and shared vision with that commitment. And the networks that must be integrated are people networks, population, cultures, and technology. With the people, it's really improving the life of the clinician effectiveness with models of integration and clinical leadership and the experience of engaging our patient population from the outset. It's dealing with populations so that we can manage outcomes of care in cohorts that are similar and dissimilar and use that information comparatively because we now have access to it. It's also culture. Absolute transparency from this point forward is going to be critical for us to maintain our credibility and believability in our consumer environment. And then technology takes place, inviting innovation and increasingly disruptive behaviors within our healthcare organizations. IT is typically a change agent. It is the representation of change from the complacency and the quiet that is the normal in some organizations and in some divisions of our healthcare environments. But it is disruptive, and it is really challenging us and channeling us to move in new directions in a data-intensive environment. I apologize, I'm moving papers in the opposite direction here, so thanks. Okay. Excuse me. So leveraging technology to manage those sustainable results comes in 3 different ways. One is through innovation, by applying critical thinking skills to improve patient and customer processes, services, and to create value. That's a connection point between our clinical environments and those that manage the data that help us transform that environment. It's service coordination and system integration, utilizing the electronic health record as a driver. Clinical transformation and integration occur, leading the organization to technology alignment, standardization, and truly a reduction in waste and variability. And it also signifies collaboration, the relationship building, the collaboration, our partnering with patients, and yes, I said patients, with colleagues and other stakeholders for continuous improvement. Those organizations that haven't yet gotten it, that the patient is really at the center of all of what we do, and those that have not yet invited them to participate at board levels as well as in our clinical councils have a long way to go to be able to realize that the systemic value of that is far-reaching and essential. So in this network integration, we're really looking at care continuity in 3 contexts. We're looking at it from a quarter process management, a quarter of it technology management, and then half of it really represents the culture. We as human beings are resistant to change, and it is really truly that cultural transformation that will create the dynamic changes within our organizations. In front of you, you see one organization's model of what their pre-clinical transformation environment looked like. It really represented the land of misfit toys, so to speak. We have silos of care being delivered without the associated connections with where the data are and what that data means, what federal regulation is telling us. And it really is representing a highly fragmented environment at this point. This is the cottage industry of where healthcare is evolving from and to. It's an economically driven model that is really representing primary volume of service rather than value of service. And in this depiction, it's representing a lot of missing pieces. It's missing the data integration. It's missing relationships between our patient populations who are standing there with question marks above their heads. They're not quite sure how to move through the environment with ease. And it is representing too the relevance and transparency that's missing in the environment from which we come. And it's also representing the why. It's representing where we are moving as a healthcare environment and why that's important. According to Root Learning, who was instrumental in the development of this model for this organization, they helped the organization see the big picture so that they could stay focused and become more engaged. Engagement is that first step in shifting the culture. So then we move into what the goal looks like. This goal looks like the transformation process and the creation of a patient-centric environment. Let's see, is this working out? The patient is in the center of this environment. 1, with technology, 2, with communication devices, and 3, with the encouragement and partnership relationship that they drive within the healthcare organization. It represents leadership alignment. These things could not occur unless leadership were organized and willing to support the integration model, as well as create the mandates that our success is going to be predicated on every single individual as members of the workforce driving in the same direction. So that we have stakeholder involvement. Again, it's both the care provider as well as the patient in this case. We have a culture that is now culturally aligning and moving in the same direction. And we have communication, both data availability as well as correct data moving in that right direction. There's also technology that aligns and enables this, but it is not the cornerstone of the success of these types of endeavors. So if we think about clinical leadership, it makes sense that we continue to want to evolve more and more clinicians in the aspects of analyzing and managing data and managing our role-based responsibilities as we evolve from managing volume to managing value. Clinicians in the IT space represent healthcare transformation. They represent influencing informatics. They are among the leadership who are most accountable for the successes of these aspects, with a focus on clinical quality and outcomes. They support decision-making at every level of the organization, regardless of their role-based responsibility. They're actually both the feet on the ground as well as those that are managing and implementing change. They help us through the transformation of healthcare integration, realizing that this changing role is changing not only for the healthcare environment, it's changing and being driven by our patients as consumers. Some of the clinical roles within IT, I started listing them and I thought, I'm running out of paper, but among them, the Chief Information Officer. In my instance, I am a clinician, and I have had a wonderful experience in realizing that I'm the glue. I often am the connection between what technology enables and what the clinician needs and what our consumers want. There's also the Chief Medical Information Officer, a physician who is aligned in that same strategy to help peers be able to utilize the data that they are amassing and truly understanding why outcomes of care are changing enabled by that information. The same thing is true with the Chief Nursing Information Officer. How many of you hold that title in your organizations? Okay. It's continuing to evolve. I congratulate you. It's a wonderful, wonderful space to be, especially in the construct of alignment with the clinical presence, the clinical leadership, as well as the data that drives our change and drives our processes. Among the others, however, are also evolving. There's a Chief Experience Officer who really is the voice of the customer, and a very important role so that we can continue to connect the dots. We have population health vice presidents that are managing now that space outside of the cohort of our traditional inpatient environment. So clinicians influencing the relevance of data analytics to transform clinical practice are often perceived as more credible. It is, however, at the same time, when we have the challenges of availability of those key resources in our clinical environment, that many of us have chosen opportunities to move in a lateral but complementary direction away from the bedside and away from analytic and research work to be able to support the work that each one of those do, to act as liaisons, to assist in the education, the workflow changes, as well as improving the design of critical decision support mechanisms to help make better clinical decisions, and to manage reporting and analytics in a way that we have never been able to do before. Okay, that little character is a little bigger there. Leading quality and compliance is also one of those bridges between where IT is in supporting the data flow and the data security, and where the organization needs to be to conform with federal regulation under the Omnibus Act with HIPAA and HITECH, and to be able to help us comply with those regulatory requirements. But certainly the opportunities to leverage innovation and to be a disruptor are part of that process of helping our organizations know what to do, what they must do, and what they should do to maintain a compliant environment for our patients. So we know that it's essential to align our people, our processes, and our technologies. We hear that all the time. But when we take on the challenges with excitement, there is really no fear about that. Change is disruptive, but it is exciting if we realize what those end goals are. And the ability to achieve the highest value, lowest cost healthcare and to realize the quadruple aim will require our ability to measure quantitatively, understand and predict performance in the healthcare delivery environment. It also helps us to understand and leverage the fundamental transformation of enterprise data that comes from new sources, data that is now aggregated with other data that has been available that helps drive quality success. And the investment today in recruiting staff with those key skills is going to be essential to help us be able to transform our organizations and in anticipation of the needs of our patient populations. Interoperability is the next segment, and really is now beginning to help visualize tying things together and providing that ubiquitous access to data that is needed. Defined as the capacity of systems, applications, and devices to interact seamlessly and meaningfully with meaningful human intervention is the process of interoperability. But it needs to be actionable. In the context of health information technology, workflow is actionable information that physicians and nurses can see within the electronic health record that helps them determine what patient information to collect and what medical services that can be provided to them. Providers cannot act on information that they cannot easily see. Again, visualizing that first frame that had the black and white siloed environment, that's the context of how clinicians have been forced to make decisions, and sometimes with inadequate information, sometimes not totally correct, And what we're striving for is connecting our clinical environment with the information that is now being made available so that they can improve clinical quality and clinical outcomes. The lack of interoperability is one of the major reasons for the promise of why the promise of the electronic health records has not been fulfilled. This is our American Medical Association, Dr. Stephen Stack's version of what needs to happen. Vendors have been incentivized to meet the flawed benchmarks under meaningful use, but we need to now replace that with benchmarks that really will help drive better coordination of care. It's that interoperability standard that will keep our patient keep us as patient-centric and remove so much of the administrative burden that today's meaningful use criteria for practitioners is unable to deliver. His suggestion that the development and deployment of Medicare Access and CHIP Reauthorization Program, a value-based program called MACRA, that it should give us a fresh start at being able to drive our core delivery and payment reform in a way that really values patient preferences and values data differently and use both the sense of value and the quality of outcomes to drive change rather than the healthcare reform that is predicted by spending cuts. Okay. Interoperability also means 5 whys. In order to ensure that seamless and cost-effective change of data and to provide a positive patient experience, there are 5 whys that need to be answered as we engage our providers as well as our patients. One of which is who? Who are those stakeholders? It's the patient, it's the provider, and it's our payer organizations. What data, what types of data, and in what forms of data can best be utilized to manage that shareable content in a secure way? When do we need that? Do we push it? Do we pull it? Or do we have it actively available in real time for the clinician? And where? How do we get to the data? Is it currently resident in the systems that we use? How do we get to other data? Through the use of health information exchanges, through interfaces, or through health science providers like the Secure Direct program that manages a secure transport for clinical data. And the why. The why is truly to support effective and efficient clinical workflows. And then the how. How do we do that? The nation is continuing to struggle with the evolution of standards-based protocols that enable us to seamlessly move data from one point of presence about a patient to the next point of presence in a way that is universally accepted and in a way that invites, again, our patient population to approve how data are being sent and how it's being transported. Interoperability also means clinical transformation. It's an organization's willingness to change. A system that's enabled by a set of processes that reflect the digitally seamless care experience that is one patient, one record across the continuum and available at all times and all places to caregivers and to patients. It is being patient-centered with ease of access, authorized access to care wherever it exists. It's managing the highest quality and best practices as the role model and providing then the availability of advanced analytics capabilities utilizing that data. It's the integration of systems and data across the entire enterprise. No longer can we meet the best of breed model and feel that we're going to be able to make progress. We really need to look at what integration is and how it makes data universally available to all caregivers. It's also standardizing and making efficient work processes within the organization from one point of data gathering and multiple dispersions of that use. It's also the clinical partnership that is led by clinicians and supported by technology. The environment in which many of us have come and those in which some of us still work, when technology is introduced to the organization, it's generally introduced by IT. It becomes an IT project, and we are evolving as a society, saying that we need to use IT for the right reasons and let them enable the access, let them manage the privacy and security of the networks, and help with the transformation and utilization of the data, but not drive the projects. We're finding there's so much more success in the acceptability as well as the utilization of our systems when our clinicians and our business partners are highly engaged to be able to leverage the use of that. Okay. In the insight-driven organization that I'm describing, and in the environment in which we are going, we're really looking at the dimension of being insight-driven, utilizing data to inform and inspire. According to Tom Davenport, in the August 2015 publication of Insight-Driven Organizations, he asks, why can organizations make decisions based on rigorous data insights rather than on experience or intuition? How do we make that happen? Leadership within most of our organizations to this point have been leaders of influence and leaders of business change, and they intuitively know and work together with one another to drive change across the organization. But that no longer will satisfy in the future. We need to use the construct of data to frame and model and market and consume data that we can reuse in different appropriate ways. That's really the power of the analytics. Clinical care coordination will depend on a healthcare environment's ability to interoperate, influenced by the need for national standard frameworks, as I described, that are implementable. We can't continue to spend valuable monies across organizations and putting our clinicians and business users in harm's way by making them change and jump through hoops. It's the same dimension of change that needs to occur at the federal level. As meaningful use was described as being ineffective, every one of our regulatory bodies is expecting our clinicians to measure different standards. And it's very, very difficult to know that the outcomes are different without really truly understanding the sources of data and alignment of those metrics across the regulatory bodies. So it is really talking about a framework that is going to work. It's also talking about the maturity of information technologies. As we evolve and as we get smarter in the technology side, we're also realizing that we're becoming so consumer-driven in the technologies that we use, because our users that are also our employees are driving that change and requiring us to think differently about the consumption and utilization of different mobile device technologies in their space. And it's also a process that ensures continuous interoperability, meaning that we need to stay data-driven. So if we look at the framework of what a data-driven environment that is insightful looks like, according to Deloitte in their university press, they're describing a 20-year history of analytics journey. We started out with stayed data. Back in the late 90s, we had data that we could compile, but it was generally not current and it was not relevant to other current data. So we had a tremendous amount of difficulty for a while. And then in about 2013, where we started looking at big data and cloud-based computing and moving lots of data, we started transforming the image of what insightful decision-making could look like. And as we evolve toward 2020, it's really looking more like a strategic discipline. Being insightful and being analytic in the presence of data is going to be what will drive our organizations to enable us to use data repeatedly and have results that are scaled to the environment in which we're working with the vision and the right talent and the management modules as they evolve. Leveraging advanced analytics and decision support in population health is really the direction that all of us are excited about. None of us put in electronic medical records just to say that we did it. We put it in so that we had unified access to a cohort of data that now could be mobilized and help us with clinical decisions. So at the enterprise level, the dashboards that will define the relationship between healthcare practice variation and value are really the cost equation. It is service plus quality divided by cost that will drive our changes going forward. It will further support the changing role of our patients as consumers who now have different expectations and want different access rights, and as well as price transparency and what is going on. That is a wonderful change that is occurring. The benefit of expansion of traditional data sources is now evolving. It's including socioeconomic, it's including environmental, as well as geolocation presence. Where the patient is where that information needs to be. And now the ability to provide near real-time predictive and prescriptive analytics and using the forward-thinking insights in addition to our retrospective insights that we've had in the past is helping us move that needle. However, we have challenges in the analytics space, and you are certainly representative of those who are driving change and thriving on the opportunity and the investment in your own professional growth and development in the analytics space. We still have a very high shortage of analytic and managerial talent associated with the high-end computing, the deep expertise that we need, as well as machine learning that is now coming into that space to help us aggregate large cohorts of data and come up with the golden nugget, five bytes of information. That's what we need. We still have, we need the right infrastructure investment to be in place in order to construct that transparency. We need an understanding of the benefits to our stakeholders, and those stakeholders are our communities of users, whether they're employees or our patient population, as well as the business. We need to know that we are driving change and being able to stay marketable and economically viable in a sea of ever-changing regulation. We need proper incentives to encourage that innovation with stickiness, the things that we do that have to take hold, and encourage the innovation to reduce that variability and improve performance. This is one of the key areas that many clinicians struggle with. We come from different schools of education. We are aligned with different experiences, and when we come to an organization, we bring those experiences with us. And now all of a sudden in healthcare technology, the electronic medical record and other change transformational applications are telling us that we must standardize and that we need to reduce the variation in cost as well as outcomes in order to be successful. And that's very hard for many in our organizations. And then data security and the bad actors that intrude on our networks and into our data are also a major challenge within our organizations. But then too, part of the challenge is our consumer population is changing. The demands are changing, and our millennial generation is really leading much of that change. According to a Pew Research study, 74.5 million millennials exist in our environment, while at the same time we have 74.9% of baby boomers who want to be in that space and are today consuming more of the healthcare dollars and more of the attention of our healthcare environment. But the millennials are so tech savvy that they want their providers to be savvy too. About 85% of millennials have smart devices that they use regularly to manage who they are, where they are, and what they're doing. About 25% of them are using applications that deal with health and wellness. So the attention to that detail is really becoming a significant storm. Millennials want to know about costs right up front, so that price transparency is important. It's important because millennials have a lot of educational debt. They don't manage risk easily, and they want price right up front, and they want it to be transparent. And it's really all about convenience for the millennials too. They want to have walk-in appointments. They want to have appointments at time frames that suit their needs, and they also are becoming so tech savvy that they want digital appointments in preference to being able to manage an appointment at all in a physical space. And then this generation is really much more social. They don't mind sharing data. The fear of the exclusivity of private data, they know that it's their shared responsibility with their clinical environment to protect and manage that data privately. But they also are very interested in crowdsourcing. They take the opinion of many people, whether it's families, friends, or others, before they make decisions about themselves. So their whole environment about change is really moving us much more toward the mobile environment. So mobile and wearable technology is really a culmination of looking at this consumer-driven environment and how do we organize and aggregate data so that we can use it effectively within the healthcare space. Healthcare is notoriously resistant to change, we know that. And the appreciation of clinical information, this limitation is most severely felt. It is our Achilles heel. We need to adapt to change with reasonable speed, but we also need to adapt to change around us because our real foundational change is taking place around us if we're not participating in it. Rick Krohn is a friend and colleague and author in the mobile health space, and he recently released his digital publication that really talks about the sweeping tide of innovation. That innovation is in the medical product and medical process space, as well as in finance and delivery model space. And the stakeholder participation innovation is predominant, and that it's all based on information liquidity. Information is everywhere. We see it on Facebook, we see it in multimedia. We are becoming more digitally driven in what we read and what we observe in the environment, but it is so available. What do we do to harness it? There's a pivot toward clinical knowledge sharing using mobile tools as a communication biosensor and wearables and near wearables on our bodies, our arms, our wrists, our heads, or in what we wear. And they're designed with every conceivable form factor with the convenience and utility in mind. This is the direction in which we are moving, but it will not be at light speed in many of these because we have FDA approval when it comes to being able to introduce data as it's relative to clinical decision making. But at the same time, what ethical obligation does a clinician have to receive and react to this this information that's being poured in by patients who have activity-based Fitbits and other devices, the Apple Watch, where data is accumulated and they're anticipating that their clinician is going to be responding to that. It really is a moral dilemma at this point because clinicians at this time can't aggregate that data and understand meaningfully that one time when your heart rate went up to 190, it wasn't because you were sitting watching television, it was while you were on the treadmill and you were overextending yourself. But if it's clinically relevant, there has to be context to it, and that yet does not exist. So. And wearables that are evolving are, again, evolving with our patient as a consumer. In a study that was done by the advisory board in 2016, they indicate that 69% of those respondents agreed that wearables are helping to improve their personal accountability. This is an important dimension. What we've been attempting to achieve is patient engagement, patient accountability, and that shared relationship. So if we're moving in that direction, then put that Fitbit on, wear your watch so that you are engaged in what's going on and where that health and wellness line departs. Within 2016, the study indicated that there were 433 wearable applications that were out on the market. There is no way that healthcare will be able to embrace 433 of them, let alone 20 or 30, once we can get to standards-based accountability and rationalize the value of how these tools of technology formulate the basis of a partnership with the care environment, we'll be able to start synthesizing some more effective ways to embrace them. But at the same time, as I described before, we're seeing patient preferences that are increasing with interest in having that online interaction with the physician. For those of our organizations that have a patient portal associated with the clinical environment, it's pretty easy to send a note to your physician or to ask for an appointment or to send clinically relevant data that the two of you are tracking so that you have that accountability and relationship. It may mean that that's the point at which the physician calls you and says, I don't need you to come in for an appointment, or I do need you to come in and I want you to see somebody else. But as we begin seeing, especially with the millennial group, 54% of those between the ages of 18 and 29 would prefer an online event of care with a provider. 49% of those that make above $71,000 a year also are indicating that their preference is shifting toward online action, as well as 53% of those who work more than 35 hours a week. So they're working full time, they don't have time and availability to go run an errand and also go see the physician, or to go from home to the physician, or leave from work to see the physician. So they're all saying it's got to be convenience and convenience in the way that matters to me. The emerging trends that have really impacted a lot of this care in the ambulatory space relate to patient engagement. Now that our systems are realizing that they have this new accountability with the patient population, they have to figure out new ways to engage the patients directly to help them manage in that preventive care space. There's also longitudinal data that the physicians don't have access to and they don't control. In the instance of a patient who's on home peritoneal dialysis, it's not an automated environment, and they rely on the relationship of the physician to be able to engage and know when high-risk values are exceeding the norms for that patient. It's also a competitive advantage. Due to the provider shortage and the increasing population that requires health and wellness management, we really need to think outside of the box. We need to do it right the first time. We need to portray a relationship with our consumers that gets it right the first time and manages that trust and loyalty relationship. And then, what are the impacts of the emerging trends on the wearables that are so consuming in our environment? Just to give you a couple of anecdotes here, there's rising interest in health data. The consumer really wants to be able to control the management of their data if they can. They want the tools inside the technologies that help them manage their health and wellness. We have 39.5 million U.S. adults using some form of wearable technology today. Advancing care coordination. Our healthcare environments are encouraging and investing in the technologies that will embrace and connect with the technology-savvy environment and the patient populations who use those devices. 51% of the millennials at this point are managing with some sort of technology chronic disease states that are current within that space. And the expansion of the FDA approvals is also giving light to the to mechanisms that will approve new low-risk technologies that will enable us to connect our patient populations and our care provider organizations more readily. Between now and 2018, the FDA anticipates approving 100 devices for use in the healthcare space, whereas in 2014, they approved only 13 of them in that same space. I'm sorry, 33 of them. But wait, there's more. The thing that does keep me up at night is this growing responsibility that I and my team of 800, and many of them have names that I can't pronounce either, that are just the magnificent geniuses that are helping us as a technology environment keep our data safe and keep our relationships solid. But the opportunity for us to think differently about privacy and security does not change within the healthcare environment. We are the stewards of the data. We have to manage that relationship with our patients in a way that enables them to know that we are protecting it, and yet the reverse is not necessarily true. Sometimes our patients get us into trouble by going to sites and then bringing the sites, our patients as our employees, bringing those sites of data into our networks. And it takes just one instance of an email that is open, that goes to a various site that introduces network risk and vulnerability that we need to be so mindful of. So it's, again, that partnership relationship in managing our patients. The risk associated with biomedical devices, as we start putting our IV pumps on our infusion pumps on our networks, there has been penetration by, again, those evildoers in the environment to embed viruses that are now destructive. And I will tell you that one of our peer institutions in Michigan was down for several days in their telemetry environment because of a virus that penetrated the network. It's even worse when, as Hollywood Hospital in California was the first poster child that represented national news, they were locked out of their electronic health system record for up to 2 weeks because of ransomware, holding data hostage. And that is just an untenable precedent in our environment, and yet the threats are becoming more sophisticated and growing in intensity. Deloitte is in the industry as one of the industry benchmarks that helps us organize around what we need to do to manage and maintain the privacy and security of that data, as well as protect our systems. And the security of our data, putting the right tools and technologies in place and knowing how to use them is one aspect to secure the environment. The other one, to reduce the detection time, is being vigilant in that space. And third, to manage if there is a crisis, and it isn't if, it is when. If there is a crisis that becomes business chaos within your organization, managing that relationship and knowing what to do so that you can create a sense of norm as quickly as possible are the drivers that are keeping all of us vigilant. We are largely working across states. We're working with the FBI, and we're working with our state policing agencies, as well as the state medical societies, to band together and try to deal with this as a clinical cohort rather than the one-offs. So truly, the patient is the most vital aspect of all of this, bringing it back to center. It's really all about the patient experience. While there's evidence that organizations are doing better in controlling data loss, today's attacks are becoming much more targeted and sophisticated. Loss, regardless of who perpetrates the attack, is what's really on the line. It's that sense of trust that we don't want to lose. It's the ultimate high-stakes game, because at some point, if that trust breaks down between the caregiver and the patient will no longer be willing to share the information and will no longer have the confidence in their care environment. Patients want to partner with us, and we need to enable that partnership relationship to be solid and durable. We need to have the availability of immediate and secure data available to the patients as well as to our clinicians, so that relationship is solid. And at the same time, we also need to recognize that our environment is changing, and with it, we have to change. There are permanent changes in the industry that our contributions demand our change for. We are investing in technology that truly allows clinicians to have a complete picture of the patient and no longer have an excuse for doing anything more or less than evidence-based best practice requires. As systems form and grow and compete more intensely, we are also requiring that data be portable, available, and so that no patient receives suboptimal care. Wherever the patient is, we should have access to that care, to provide care. And we're changing the economic model in the industry so that paying for value is now becoming more important than volume, by ensuring the right care, the right reason, the right place, and the right time for our patients. And finally, we truly recognize that the true owner of the medical record is the patient and the family. And if we are unable to get our patients and families to believe in us and to partner with us, we actually need to treat them as a partner in order to move forward. So bringing it back to where I started, as a nurse, my why is the patient experience. As a CIO, it is engaging and being believable within my sphere of influence, a change agent that can help with adoption and help with the transformation that is necessary. And it is also in creating an environment where my 800 staff have the opportunity to grow in the dimension of the digital revolution that is transforming healthcare, and creating a succession plan so that generations that follow are really relevant in this space with them. And as a patient, I hope and I believe that my patient experience is also a dimension of being able to manage the metrics that matter, the quality and the patient safety, and that my experience as a patient and as an opinion of one are also making a dimension of change. Thank you. May I take questions? Yes, Dr. Oswald.
Is there a microphone? Okay, I'll come forward because we want the webcast people to be able to hear.
Thank you.
Thank you very much for a very interesting and wide-ranging overview of the challenges you face in your role and some of the solutions and directions you're pursuing. I'd like to hear more about a particular statement you made, and I wrote it down.
Okay.
Every decision should have a single source of truth. And I think about that from a scientific perspective, and I think we don't usually think in terms of truth. We think in terms of the quality and the preponderance of the evidence. And we like it better when there's not just a single source of evidence, but multiple sources that mutually support one another. But but you're talking about a different context, and I would appreciate your telling us more about why the statement applies in the context of clinical and management decisions.
Okay, thank you. Thank you, Dr. Oswald. Boy, a very relevant context indeed. The relationship of a single source of truth is represented in the dimension of a single patient record, where we have the same kind of information known about an individual, and it is resident in a single location. It also represents in a data warehousing strategy that manages that data. Although data about the individual comes from multiple sources, there is the definition, a governance standard that represents that the data warehousing cohort is that single source of truth about which we pull data, we analyze that data, and we make clinical decisions. Also, however, relevant in the research space, I would agree with you, and having a rich opportunity and experience at the University of Pennsylvania, it really is the amalgamation of all of those multiple sources that creates the space of decision making. Thank you. Thanks. Okay. Any other questions? Okay. Thank you. I truly appreciate this opportunity, and appreciate that my colleague Marion Ball is sitting there actively attentive. I have one other aspiration for the period of time that I'm here in Baltimore, and it's to spend some time with Marion and catch up. So thank you.